So good afternoon and welcome to the third webinar of the year in the Tobacco Control Program webinar series. This is Taylor Kennedy with the Emory Centers for Public Health Training and Technical Assistance, and I'll be the moderator for today's webinar. And today's webinar will focus on evidence-based decision-making for tobacco prevention and control. So as a reminder, South Dakota's 2020 to 2025 tobacco control state plan goals include prevent initiation, promote cessation, eliminate exposure to tobacco, and achieve health equity. So today's webinar connects to all four goal areas as evidence-based interventions are an integral part of the entire state plan. So here are some friendly reminders of our housekeeping and ground rules for today's webinar. Please be sure to mute your audio. Cameras will remain off. We'll have time for questions at the end of today's webinar, but please feel free to put them in the chat box at any time. And please be sure to participate in any interactive portions of today's webinar. As a quick reminder, this webinar can be counted for continuing education credits. And finally, this webinar is being recorded and the recording will be available later on. So there may be times throughout the webinar when you'll want to provide feedback. One way to do that is by using the reactions. So in the black Zoom toolbar, you'll see an icon that says reactions. Click on that and a box will pop up with a few that you can choose from. So you can see more reaction options by clicking the three dots in the upper right corner of that box. And you can also scroll through the list or search with the search bar. So today we will be using the poll feature. So let's go ahead and practice that real fast. We want to know if you had a superpower, what would it be? It'd be super strength, invisibility, super speed, flight, or X-ray vision. All right, where almost everybody's participated. All right, let's go ahead and end that poll and share the results. I think everybody wants to be invisible. I think that's a pretty good one. Perfect. Well, thanks for participating in that activity. All right, so please note that when we use the term tobacco on today's webinar, tobacco refers to commercially produced tobacco products only and never the traditional tobacco of our Northern Plains American Indians. So after today's webinar, we hope you'll walk away knowing more about evidence-based decision-making principles and how to apply them to tobacco prevention and control. And today's presenter is Sandra Melstad. Sandra is a public health consultant and owner of SLM Consulting based out of Sioux Falls, which is focused on improving health and achieving health equity through prevention, multi-sector collaborations, and evidence-based decision-making. Sandra has worked in public health for over 16 years and works with state, regional, and national multi-sector public health-driven organizations, health systems, and universities focused on needs assessments and action planning, public health workforce capacity building and training, and evaluation. And Sandra's targeted focus has been on evidence-based decision-making and addressing health inequities by building the capacity of the public health workforce. Sandra also currently collaborates with multiple governmental and non-governmental organizations on public health issues related to opioid use, cancer prevention, and chronic disease prevention and control. So welcome, Sandy. I'll go ahead and pass it over to you to share your slides.
Thanks, Taylor, and welcome everyone. Great to have you all on here, and I see some familiar names. So welcome to those of you who I've worked with, and welcome to those of you who I'm just meeting today. So as Taylor mentioned, I've worked in public health for many years and I do a lot of training around evidence-based decision-making and do a lot of work around that with partners across the state as well. So this is a subject pretty near and dear in my heart and always excited to talk about it. And what I was told leading up to today that this was your #1 topic area you were interested in having some training on. So hopefully what I share with you today gives you some good starting point or builds off what you already know. And some of you maybe are experts at this already, and it may just be a refresher for you as well. So certainly welcome all of your experiences and insights into what I share today. So I'm just going to share my screen and we'll get going here. Okay, give me just a second. Okay, there we go. Can you see the normal slides now, Taylor?
Yep, looks good.
Okay, wonderful. All right, well, again, welcome everyone. My name is Sandra Melstead, and I was asked to visit with you today about evidence-based decision-making for all the great work that you're all doing around tobacco prevention and control. And so some of it, as I mentioned, maybe repeat for some of you. Some of you may be already leading the way with this, and some of this may be brand new for you. So understanding this is a pretty heavy topic and certainly an important area to be driving a lot of the work that you're all doing, and certainly important within the world of public health. So these are learning objectives that Taylor went over, so I will not cover those. But to get things started, I wanted to give you some definitions. So when we're looking at evidence-based decision-making, really what we're looking at is the process. And what you are all doing in your work is likely being driven by evidence that was decided through a process, and certainly driving a lot of the work that you're deciding to do and the populations you work with. So evidence-based decision-making is a process for making decisions about a program, practice, or policy that is grounded in the best available research evidence, practitioner expertise, which would be yourselves, and then the relevant context of where you're doing it. So that might be the community you're working in or the population you're working with. And so when we look at evidence-based decision-making, we know the need for it in public health and healthcare really calls for practitioners such as yourself to include evidence-based decision-making in your work, and to help meet the demand for population health approaches to problem solving that yields measurable outcomes. So the idea is that when we use evidence-based decision-making, we have a higher likelihood of success of an outcome and to achieve those desired results that we want, because there's been a lot of research to inform that particular program, practice, or policy. So I wanted to just touch on really briefly with you. Hillary and I had a lot of conversations to try and understand what kind of work we're all doing, what type of training you've had thus far. And so this, I'm just going to share with you what's called evidence-based public health framework. And some of you maybe have already seen this, but this is a framework that was developed by Brownson et al. And really what it's meant to be is to understand how we can go about practicing public health through an evidence-based framework. And really if you haven't seen this, it really is starting with that assess the community, which Hillary shared with me. You do a lot of that, which is really wonderful, and in my opinion, probably the baseline of things that we really need to do to start that program, practice, or policy. But you can really see it's a circle. It's really taking to understand what is the issue of focus. You need to assess the community to understand what are the issues impacting them, taking around to quantifying the issue, developing a concise statement of the issue. Now that we have all this literature and all this data, then we're going to search and summarize the scientific literature. So what does it all say? What does it mean? And then we're going to take all of that to really develop and prioritize those program, practice, or policy options that many of you are already doing. And then use that to also conduct action planning to implement a program or policy, and then evaluation, which is always a really important piece of public health, is important within the evidence-based public health framework. And as you can see, it's a circle, it's a cycle, and some things maybe you've already done, so it doesn't necessarily have to start and end at the same point. You maybe have already done some of those things, but the idea is that it's really there to help you drive evidence-based decision-making. And then more importantly, it's important to look through all of these steps through a health equity lens, which is in your state plan. It's the work that you're driving it, but it's really to integrate health equity into your practice. Or I always say make it the rule rather than the exception. So make it a normal part of the work that you're doing as well. So again, this is just to show you what the evidence-based public health framework is. So now I want to talk a little bit about the use of evidence-based decision-making. And so just wanted to get your feedback. Some of you have already done it, but what do you think is the value of evidence-based decision-making? So Alexis has a poll she's going to launch, and I'm going to just invite you to share that. And you can select one or all, but I want to know, what do you think are the value of tobacco evidence-based interventions that you're all doing? We'll give you about a minute, 30 seconds or so to get that answered. Okay, looks like we're done polling here. So Alexa, if you want to close that, you can share results. So looks like most of you had, some of you had all of it. A lot of it's around building programs credibility with partners in the community, provide a framework for planning. Maybe a little less on securing future resources and justifying investments. So yeah, so there's a various different values of evidence-based, specifically tobacco evidence-based interventions. So thanks, Alexis. I think we'll stop sharing that. Okay. So the answer to your poll is actually all of them. So they're all important. And so the value of tobacco-based evidence-based interventions are all important. Some maybe you find it easier to elevate than others, but they're certainly all important in the work that you all do. So one thing I wanted to highlight, and so I pulled some information from a tool that you probably already use, but it's the evidence-based practice toolkit that's on the CDC's website, but it's specifically around tobacco prevention and control. So when we talk about the values of evidence-based decision-making, it's wonderful, but what the research is finding is there's a research to practice gap. And so what that means is that we know what the research shows, we know what the evidence shows, but we're seeing a gap in practice. So the two aren't necessarily lining up. We know strong evidence supports, for example, shows comprehensive smoke-free laws, reduce tobacco use and secondhand smoke exposure at the state and local level. And again, this is probably something you're very, very, very in tune with, but then you can see on your screen here, this is as of April 1st of 2021, the statewide laws and the local laws. And so we certainly see some gaps. So we know what the research says, but we also see a gap in practice. And so, so certainly those are some opportunities to kind of elevate some of that evidence-based decision-making and how we disseminate that to support our work as well. And this is a slide I won't go in depth with, but again, you can access all this information through that toolkit. But what this is showing you, they did a nice job in this toolkit, is to show you what the component is of a particular tobacco prevention and control strategy, what the implementation gaps, and then what are those key messages that maybe need to be elevated to address those gaps. So for example, if you're looking at cessation interventions, we're looking at there's a gap in disparities in access to commercial tobacco cessation treatment and quitting success. So maybe that key message might be look more at talking about the effectiveness of evidence-based cessation treatments to help increase that access for those disparate populations. And so this is some good information that they kind of elevate to see what are the gaps and how maybe can we have some key messages to address some of that. So I invite you to take a look at that a little bit more in that toolkit. And so what they found, what the research has found is researcher barriers and practitioner barriers. So the researchers are very in tune with what's the discovery of the information, what's the science to drive those evidence-based interventions, where as practitioners, more concerned with the value the practical ways of to use the information. So sometimes, even though the research says something, it maybe is not being implemented as it should be, or vice versa. And so those are where we're seeing a little bit of a divide, and the research is talking about the gap, that research to gap practice. And so what this also talks about is what skills are needed to bridge research to practice gap. And so things that are elevated in the toolkit, looking at finding evidence. So how do we teach you and know about finding evidence? Assessing the strength of evidence, how well it fits with your population and setting, organization's capacity to implement it. So just because the data supports it, does your organization have the capacity to implement it, or the communities you may work with? Communicating about evidence to stakeholders, adapting evidence to their population or setting, which I'm going to talk a little bit more about later. Implementing evidence with quality, and then sustaining use of evidence-based interventions. So if those are skills that you have, wonderful. If those are skills you have opportunity to elevate, those are some things to think about and look at exploring with bridging that research to practice gap. And so here's, again, in the same toolkit that I'm referencing, they really talk about how do you put evidence into practice. And so I'm going to touch on a few parts of this, but it's really a process. And it follows similar to that evidence-based public health framework that I showed you, but starts with assessing the evidence, building organizational readiness, engaging stakeholders, disseminating evidence-based interventions, implementing evidence-based interventions, evaluating those, and then also sustainability of those interventions. And all of this really is important to be done in the context of the community that you're working with and with the community that you're working with. But more importantly, making sure that the evidence that is supported around a particular population is what you're using to implement that program, practice, or policy. Okay, so just a little bit of refresher here. What is evidence? And some of you maybe already know this. So again, just a refresher for you. So we have all types of evidence. So there's scientific literature and systematic reviews, and I'm going to talk more about that here in a little bit, show you some examples. Scientific literature in one or more journal articles, and this is evidence that we would say is probably a little stronger. It has a lot of science to back it up, and it is things you would probably find in the literature and the research that supports the work you do. We also have public health surveillance data. So those are things looking at behavioral risk factor surveillance system. That might be something you all use with your work. Program, well, you're collecting evidence and data with your programs. That's certainly evidence. We also have qualitative evaluation data, and over time, qualitative data has become more, I would say, trustworthy and something that is of value. A lot of times in the past, we've seen qualitative is not as strong as a data source, but it's really great to understand that those experiences of your community members and stakeholders. Media marketing data, so those are things you may already get from some of the work you do with tobacco prevention and control. Word of mouth, so that's still evidence. Personal experience, certainly evidence as well. But the reality is we have different levels of strength of that evidence, going from objective down to subjective. But the reality is it is all evidence, and it's really in the eye of the beholder. But what we really are important is looking at what you're using to drive your evidence-based tobacco prevention and control work. Likely is going to be driven mostly kind of at the top, the objective data, but not necessarily all the time, because back to what I was saying, this is within the context of your community. So it needs to be something that is supported and it fits the community and population that you're working with. Okay, so just some audiences to think about that you're already working with. So if you haven't thought about it, or maybe there's some opportunity for you to elevate audiences you do work with. For using evidence-based decision-making, we have public health practitioners. So obviously we're all using those in the work that we do. We use that for funding, we use that for programming, a lot of different things that we're using within that. Certainly stakeholders that you all work with, your communities that you work with, partners that you work with, that's evidence is always good to engage them, help drive the work that you're all doing as well. We also have researchers. So you can do the evidence without having the research to back it up. So the researchers are always a really important part of understanding evidence to guide the work that we all do in public health. And then policymakers, and I know Hillary said a lot of you do policy work. So this is always an important area too, is we want to see policy driven, and certainly looking at tobacco policy, that data piece is always that really important piece of that too, and certainly can provide more credibility with the things that you're trying to put in place. So there's a lot of different audiences, and we're looking at using evidence-based decision-making and different ways to disseminate that information as well. So then we look at evidence domains. So I talked about this with the definition before. So you're looking at the best available research evidence, and the keywords there are best available. So sometimes the best available is 2 years old, and that's what you have to go with, depending on where the data is from. So always have to keep that in mind with what's the best available. And that's also sometimes called research evidence. Then we're also looking at population characteristics, needs, values, or preferences, and that is also sometimes referred to as that contextual evidence. So keeping in population characteristics that you're working with. And then looking at resources, and that includes practitioner expertise, and sometimes that's called experiential evidence as well. But all of that is also informed through the environment organizational context. So things such as professional influences, your legal climate, relational climate, population, political support, social climate, local infrastructure, funding. There's a lot of things that come into play with that too. So all of that comes in to make that decision, to drive the evidence and to drive the program, practice, and policy that all of us work with and are driving our work as well. So when we look at using evidence, there is typically a process that's recommended to go through using that evidence to guide the work that you're all doing. and even that practitioners, researchers are doing. So we want to look at first gathering that evidence. What evidence is there to help support the work that we're trying to do? What is it saying around the issues that are impacting the populations you're working with? Then we're looking at interpreting the evidence, and that's looking at things as exploring experiences, preferences, and values of local stakeholders. Certainly want to assess the fit of strategies, and again, I'll talk about that here in a little bit. And then you take all of that information to apply what was learned from the evidence. But you've probably all come across this in your work, but it's important to understand that your community or stakeholders may weigh that evidence differently. So some questions that maybe you have already, or you might consider as you're trying to inform that decision making is what types of evidence would be the most useful, the work that you're doing? Are there concerns about the strength of the evidence? So is it quality evidence? Is it something that, or was it gathered from like 10 people? So those are things to think about from that quality of evidence. Is intervention compelling enough to act now? So even though you have this intervention, is it feasible? Is there a readiness by the organization, the community that you're working with? Also, what barriers might exist to using the intervention, and then what stakeholders know about commercial tobacco use and about misconceptions they may have as well. So there's a lot of things to think about within that perspective when you're using that evidence to make decisions as well. Okay, so now I want to kind of show you where to find the evidence. So I'm not going to go just keeping a track of our time here. I do have some websites I might pull up and show you, but there's so much information out there, and so it can get kind of overwhelming. But I pulled together just kind of some key data sources if you're not already familiar with, just to help you inform a lot of the work that you're doing. So this is the resource I was talking about earlier. So this is putting evidence into practice, and so this is a great guide. If you don't already have it, I'm probably already preaching to the choir here, but this is a really good guide to show you how to use evidence to guide your work. And so I recommend that as well. And all of these have a link at the bottom as well, so you'll be able to access all of those as well. When we're looking at systematic review, and so I talked about that before, kind of being at the top of the rung of that quality of evidence. When we talk about a systematic review, basically what it is a bunch of research articles and research that was reviewed on one particular topic that has come together to kind of form that strategy or intervention that's recommended by evidence. So it is a very structured, rigorous process to go through systematic review that gets to the point of where it is highlighted in these types of resources. And so 3 of them that I think would be you probably already use or very relevant to the work that you're all doing. The community guide is one that I've used a lot, and this is very specific to chronic, but that has a bevy of systematic review resources, and that's certainly a really important website that I'd encourage you to take a look at if you haven't already. I'm going to show you an example here on the next slide too, to show you what's in there if you're not already familiar with it. The U.S. Preventive Services Task Force is a little bit more in the clinical side of things, but that is strongly used a lot, certainly with the cancer program through the Department of Health. But that really looks at more of the clinical, and it has recommendations for different levels of evidence as well. And then the Campbell collaboration, that's just one example. It has some social science and education oriented systematic review resources as well. So those are ones that really look at that systematic review and would be kind of that top rung of evidence that you would be looking at to guide the work that you're doing. And so this is just an example of the community guide. Again, you're probably already familiar with it, but this is one on tobacco, and they've done so much to update this over the years. You can look at it by topic. It also has, you can look at it by the level of evidence. And so they show you the strength of the evidence, and all the way from recommended evidence to insufficient evidence. And it doesn't mean, for example, the insufficient isn't evidence, it just means there's not enough to kind of back up that particular strategy. And so this is one particular website. Again, if you're not already using it, has a lot of great information. Also talks about how you can implement intervention and considerations for that as well. And so this is I think one of the go-to resources of systematic reviews for chronic disease prevention and control, and certainly with tobacco is relevant as well. So this is a really good tool. If you haven't used PubMed before, this is might be a little bit more than what you're interested in, but this is where you go to find research articles. And again, can go back to that kind of that higher level of evidence. But PubMed is a really good one. actually sat on a good webinar with the health sciences librarian from the University of South Dakota. And her recommendation was to use this. If you ever use like a Google Scholar, you Google an article, she kind of referenced to use something like this more than you would say like a Google format as well. So this is kind of like Google Scholar if you ever use that, but this has you can do search terms, you can do things, but this is really pulling up articles, research articles. So if you ever need anything from that type of evidence, PubMed.gov is a really good resource to pull some of that. I would say that higher level of data, that quality data as well, evidence. Then we're going down that list of evidence. So still good data, maybe not as high as the other ones, but next we have surveillance resources, and that's certainly something that's used very heavily in public health. So the CDC Surveillance Center has a, if you click on this site, it gives you a ton of different types of surveillance databases that are used. So tobacco's in there, heart disease, behavioral risk factor surveillance system. So basically that link is just an entry into a lot of different types of surveillance resources that you can access as well. The behavior risk factor surveillance system, again, you may already be familiar with that, but that's one that we use a lot in chronic disease. So looking at our health behaviors, chronic health conditions, and use of preventative services. And so every state has one, and every state has some questions they may ask specific to their state as well. And you maybe already have that with the tobacco focus as well, but this is specific to adults. And then again, things you're probably already very familiar with, also have the state tobacco activities tracking evaluation system, which is an interactive application that can present current and historical state level data on tobacco use and prevention and control. So those are some websites I invite you to take a look at. If we have a little bit of time at the end, I'll try to pull some of these up for you. And then we're looking at what I like to call cross-cutting data, tools, and resources. So Community Commons has evolved a lot over the years. That's a really, there's so much stuff in there, but you can look at like a vulnerable footprint, certainly with your health disparate populations. They have a lot of mapping features in there, but that's a really good diverse tool that you can use to really look at advancing equity as well. Healthy People 2030 is recently updated, and so they have so much stuff in there. So I'd invite you to look at that as well. It has information around data sources, objectives, and these might be things you're already measuring within your state plan as well. The U.S. National Library of Medicine has a lot of links as well. PubMed, which I just showed you, Medline Plus, so it gives you a lot of different access points. And then County Health Rankings, if you have used this already, great. If you haven't, they have what's called What Works for Health. And this is kind of like the community guide. And what it really shows you is the different levels of evidence and then a topic area. And so without, I might try to show you a few of those. We get some time, so I don't screw up my slides here right now, but that's really very similar to community guide, but it shows you different types of evidence around certain topic areas, even who the stakeholders should be included with that. So that's a really good resource as well. So those are just some examples of data sources. And like I said, if we have a little bit of time, I'll open some of those up and show you here at the end of that. But I just wanted to kind of show you there's so much information out there, and there are some commonly recommended data sources to find evidence, but there are also some more out there that probably don't even familiar with. Things are continually evolving, but certainly some places that you can go to gather that evidence to guide your work. So the other thing I'm going to move to next, and I forgot to mention again this, but I invite you to use the chat too. If you have questions, certainly we can explore those at the end of this, but certainly invite you to use the chat. You have questions, comments throughout this as well. So Hillary said you're all pretty well versed in assessment. I do a lot of community assessment, needs assessment. So, so this is an area we like to talk about. I'm just going to touch on it briefly, as that is a point of the evidence-based public health framework that we talked about, but also really true to what a lot of the great work that you're all doing. Excuse me. All right. Okay, so just a refresher, what's a community assessment? So that's a structured process usually conducted in collaboration, which you see is highlighted and bolded, with other community groups and organizations for determining the health status and needs of community members and identifying community health improvement programs and services on which to focus. So this is something you're all doing. You've all done it from what Hillary says. And certainly this is really kind of that foundational piece of building that evidence. And more importantly is engaging that community throughout this entire process, certainly to ensure that buy-in and support and sustainability, but also opportunity to look at health equity through that perspective as well, and making sure you're engaging those populations impacted by the issues that you're addressing as well. And so certainly we know that's a really important part of building that evidence. There are some common steps. Again, some of this is refreshed for a lot of you, but you can kind of see again, it goes how we go about doing those assessments to really understand the issues that are impacting the communities that you're all working with. Starting with planning, again, much of it is very community driven, and engaging those community members throughout that process to prioritize those health issues, develop those plans that you're all working with, or if you're doing an action plan, implementing those, but then also evaluating those to see what's working, what's not working. And I want to just point out one really important part of this particular framework, which is the American Community Health Institute, American Community Health Institute. But the center of their process is community engagement. And again, that's a huge important part of the work that we do in public health, and has really been elevated a lot, certainly over the last few years with COVID, but we know community engagement is really that great opportunity and necessary to engage the community and the work that you're all doing and help them kind of be part of that decision making and the process as well. And then more importantly, we want to look at through that health equity lens. That's important part of the work that you're doing in your state plan. So meaningful community engagement for health and health equity is important when you're doing that needs assessment. Also develop those partnerships and coalitions to advance health equity. We know that's an important part of community health assessment. Also helps you identify and understand health inequities, looking at opportunities to look at data that maybe is disaggregated by race, gender, ethnicity, other demographics that can help you really understand who's impacted by those issues. And then also using that to make a health equity oriented strategy selection, design, and implementation. And so those are things, again, always important to think about is how do you make that health equity part of that process ongoing? So integrate that throughout that, but certainly part of building the evidence as well. And then I just wanted to tie in back to that community engagement piece, which again is supported by evidence. But this is really just a slide I use in other presentations, but it can show you the different levels and ranges of community engagement. So there's all different types, and you may have all different types that you've done with your communities, but you may be doing outreach, which, for example, is a matter of you just providing the community with information. You may be up to involving, so entities cooperate with each other, all the way up to shared leadership, where your community is involved in that decision making. So you have different levels of engagement of the community throughout the community assessment process. But the idea is that you have meaningful community engagement across this spectrum of this community engagement continuum. And certainly, again, the biggest important point is that you're engaging them throughout that process and having them have that shared participation to help really address and understand the issues impacting their community. So that's just one thing I just wanted to touch on with community health assessment when we're looking at the evidence as well. Okay, so the next I want to talk about implementing evidence-based interventions. And so there's a lot of things that come within that, but I want to talk about adapting interventions. And so that's something I think sometimes gets missed a little bit. And so I wanted to touch on that a little bit. But before I do, I just want to know, you can throw in the chat, I invite you to do that. Why do you think programs, practice, or policies fail? What have you seen or haven't seen, or things that haven't worked for you? Why do you think that is? Or what are the reasons for that? Inconsistency, don't have the community, lack networking, engagement. Well, are quick typers, starting off with unattainable goals, lack of time, money, or buy-in from agency enforcement. Sure. Networking, community engagement, don't have the community buy-in. A lot about the community, it looks like. Not a best fit. Yep, that's what we're talking about, adaptation. That's intervention needs to fit the community needs. Those are great. Yeah, so those are, yeah, you all hit the nail on the head. Those are a lot of those reasons why we can see that those programs, policies, or practice failed. I think sometimes we jump the gun on things and we don't we don't do our due diligence to kind of make sure we're doing the intervention that fits the right community, but a lot of other things that come into play with that. Hard to get older people to pass tobacco policies. Yep, certainly. I'm going to talk about policy a little bit too. So that comes into play with, we know what the research says, but how do you get the policy implemented, even though we know what the research says? So there's a lot of different factors that impact that as well. Excuse me, thank you. Okay, so yeah, there's a lot of different reasons why they fail, and you could even be doing it right and it still fails. But the idea is that higher likelihood that we use that evidence, we're going to have the higher likelihood of success, but you still have to deal with a lot of different factors that can impact that as well. So there's some different types of implementation strategies now that you have this evidence. And again, this is highlighted well in the evidence-based toolkit for tobacco prevention. So there's planning, financial, quality management, education, infrastructure, external context. And so these are all various types of strategies that maybe you have used or could use in your work. But one thing I want to focus on here is looking at that planning perspective. And so some of you typed in the chat some good things that it doesn't fit the community. And that's exactly what this is looking at. You need to adapt the interventions to fit the community that you're working with. So when we talk about adapting interventions, I use this quote a lot, but what we're talking about is there's nothing inherently superior about any intervention method or any method of social change. It always depends on the appropriate fit of the intervention with the person or population and their circumstances in the delivery setting. So yeah, it's you can have this great intervention, but if it doesn't fit your community, then it's not gonna fit. So it's always important to think through that perspective of is the intervention designed to fit the population we want to work with? And if it's not, then there's some steps you have to take to assess how you can make it fit or adapt it to fit. When we look at adapting a program or intervention or policy, there's kind of 4 things that you look at with that. And again, this probably get a little researchy and nerdy from the data side, but this is really important. We're looking at testing to see if an intervention works, if we are adapting it to a different population. So program adaptation, which is deliberate or accidental modification of a program. We also look at the core components of a program. So elements of an approach or program that fundamentally define its nature and are most likely to account for its main effects. Looking at theory, logic models, the empirical evidence. Program fidelity is the closeness between the developed and the defined components of a program and its actual implementation in a given setting. And then fit is the degree to which a program has been adapted to incorporate setting and audience characteristics in its planning. And so a lot of those things we want to look at are those fidelity and fit. So it's making sure it's doing what it's supposed to do and it fits. And if it's not, then those are things I'm going to show you here in a bit. You have to really take in consideration. And you maybe don't have to do this with your grants and program projects that you're doing now. Maybe this is in the future, but things to think about for future funding opportunities or things that you're looking at as well. So again, when we look at those core components of a program, policy, or practice, really looking at 3 kind of key areas. So this particular is talking about program, but looking at program structure and audience. So it's the basic design or organization of intervention, but program policy. The content, so the type of information, learner objectives, skill building activities included in the program, or even the practice or the policy, and then delivery. So the method used to transmit the program or practice to the target audience. So those are kind of those core components we're looking at those. So the idea is that if we look at an intervention, I know in South Dakota this is used a lot too, and I have some of you on the call who maybe on this webinar who have done this or participate in this, but I've seen a lot of examples of interventions that maybe are designed for certain populations that maybe it was tested and designed for a population of typically like your middle-aged white women, something like that. But then if we want to try that in, say, a tribal community, you can't go one-to-one. Those don't fit. And so those are examples I know that a lot of things have been adapted in South Dakota, really making sure that we're adapting that, culturally adapting that to fit for our tribal nations as well. And so those are some examples of things that you have to think about when you're going to use an evidence or address an issue. Does it fit the population we're in? And if it doesn't, then you have to think about what do we need to do to make sure it fits, or maybe you have to find a new intervention or strategy. So how do you find a strategy that works? So explore strategies that have worked in other communities or populations or are recommended by unbiased experts. So again, you might have to look at another strategy. If you found one and you have to change it so much that it's going to change that fidelity and that fit, maybe you have to find another one. But the idea is that you're exploring other strategies to see what are out there. Review those evidence-based resources that I showed you. Those have a lot of great information in there. Excuse me. In fact, I've used that for a lot of the work I do with my colleagues on cancer prevention. We actually use a lot of strategies in the community guide in our state plan. So choose the right strategy for the community or population. So things to think about: how similar is your target population to the population strategy that has benefit? And that's the example I just talked about with middle-aged white women, and say if we're looking at a tribal population. Do they fit? How similar are goals to the outcomes the strategy has been shown to change? And then can you implement the strategy as it was studied? So for example, the methods that they talk about, maybe they offered 6 educational sessions and you only want to do 3. Like, what do you need to consider with that? Is that still going to give you the same outcomes that you're not? So if not, how will you conform the approach is effective as well? So this is a good guide. It was actually developed by the Cancer Prevention and Control Research Network of the Prevention Research Center program from the CDC. But this really gives you kind of a green, yellow, red, what you can go about adapting and what you shouldn't. And the idea is that if you're going to be in the red, probably maybe you need to look at a different strategy. So for example, things that you can change are names, pictures of people or places or quotes, hard to read words. Sometimes we've seen some adaptation, culturally appropriate language. So that's not necessarily going to be can change that fidelity or fit. Timeline, cultural indicators, ways to reach your audience. You know, you have a different population, different ways to reach them. Incentives for participation. Things that are cautionary are substituting activities. Those are things not sure about. Adding activities to address other risk factors, behaviors, and changing the order of curriculum or steps. And then we're looking at the red area, the theory used to guide it, the topic. So if we're doing a project on diabetes and we want to pull a strategy from tobacco, probably not the best fit. And then deleting core components, reduction of the program, and putting in more strategies that detract from those core components. But have some other tools can share with you as well. But these are things that really have to be taken into consideration when you're adapting. But again, you all had some great comments. It doesn't fit the community. So those are things you need to consider. And a lot of times it may mean piloting it before you're doing a full-on implementation. So maybe you need to change things. Then you got to see if it works. And if it doesn't work, then you need to adapt it to fit better. So, so it's not just as simple as changing a few things and it'll fit a population. There is a process that you need to go through for adapting intervention to make sure it's fitting the population appropriately and getting the outcomes that it was designed to get. All right, checking my time here. So getting close to the end here. So finally, I want to talk about how you use evidence. So looking at policymaking, action planning, and partnerships. So again, Hillary said you do a lot of policy. So I just wanted to touch on this briefly. Here's some good literature from Brownson et al., but it really talks about those domains of evidence-based public health policy. Again, looking at process, content, excuse me, outcome. And so the process, it's really recognizing, identifying key factors to inform the policy process to further, also further critical to furthering that evidence-based policy. Content, as we talked about earlier, this can really look at that quantitative and qualitative that maybe was gathered from research conducted, maybe it was interviews conducted with people, but you do have actual data that's going to drive some of that policy perspective as well. And then the outcome. And so the idea is that your documentation of effects of implemented policy is really important with evidence-based policy as well. Certainly you've all talked about and had some comments in there, like here's the evidence, but you can't get people to adopt those to, you know, if you're looking at multi-unit housing policies, whatever you're looking at with that. But making evidence-based policy is certainly a continuous process. What research does show is effective does not, unfortunately, does not always equal policy. And again, you can all speak to this, I'm sure. You may find policymakers have that lack of value on prevention, whoever you're working with, insufficient evidence base, power of vested interests, research is isolated from the policy process. So again, they do all this research, but they don't really take into consideration what it takes to get a policy in place and what things are influencing that. Maybe practitioner lacks skills to influence evidence-based policy or understand what policy is. and then just individuals from different disciplines. So there's certainly factors that come into play with that policy making, looking at the evidence base, which some of you are very familiar with. And then again, back to the community guide, I just want to highlight an example that's on tobacco use. So if you haven't seen this already, this isn't a community guide, but that is gone through a systematic review. So obviously we have a smoke-free law in South Dakota, and that would certainly be guided by the evidence that we know supports that too. And so the community guide has some good information around there around smoke-free policies as well, which I'm sure many of you have used. I did want to just touch on this. I can kind of show you back to what I was talking about before, but see where I have my mouse over here, you can see this particular evidence-based intervention or strategy. You can see here it says recommended, so that's strong evidence. So it was recommended back in 2012. It also talks about the audiences that come into play with the policies. And then it's also showing you the settings. And so we know there's so many different areas with smoke-free policies, but it really talks about where this particular evidence-based strategy is applicable to from audience or setting, and then the type of evidence. And that strong evidence in this case would be that highest level. So just an example to show you how it looks on there as well. And then finally, just a couple of things to wrap up. We know that evidence can be used in action planning, which I'm sure many of you have done. So if you have your data, you have your evidence, use that to kind of drive your action planning. So is your most current and pertinent information used as a base to drive your action plan? Are the strategies in your action plan evidence-based? And this is when I really hit home with that. I think sometimes people get hung up on what type of strategies depend there, but always really important to look at the strategies that are including your action plan are evidence-based. And it should make your life a little bit easier as well, because they're already developed, they're there. Hey, this strategy might be something we could do, and it's evidence-based. That's really important to think through that lens as well. Are there intermediate objectives and measures, not just long-term measures, to assess that? Evaluation, of course, is always important. And then things that we'll get to here at the end. We'd love to hear your tips and other experiences you've used with your action planning as well, or questions. And then partnerships. So again, we talked about that earlier. Partnerships is a big part of what you all do, what we do in public health. Always good to have talking points. You know, maybe you have people who have questions about the data around tobacco programs that you're doing. Always good to have talking points ready for that if that's something you need to look at, especially with policy. What you need to do to appeal to those partners that you're working with. Stories sell. So we know combining evidence and local success to tell the intervention story can sometimes help as well. Consider what agency or organization may be interested in the evidence that you have as well. And there's certainly other avenues to use that evidence. Certainly we look at a lot of things around collaboration and ways to kind of reduce that duplication of effort and support the great work that you're all doing as well. And then finally, I just wanted to touch on some brand new resources that I'm pretty excited about. We've been trying to get this developed here probably for the last couple of years. So Good and Healthy South Dakota is the kind of the partner web portal I'm sure many of you have used, but through the chronic disease program. But actually have the website just got updated, and we have now an evidence-based decision-making webpage, which I'm pretty excited about. So lots of things in there. So I invite you to take a look at that, but that's meant to be there to support you all in your work. So there's a lot of resources on evidence-based practice, evidence decision-making in there. And then 2 resources that you were sent by Taylor that we developed as well is evidence-based decision-making checklist. So that's there to help you understand how to explore the evidence and make sure that you're using it appropriately. And so takes you through step-by-step with that. That's once you have an issue. So this isn't necessarily doing an assessment. It's now that you have the issue, you know what the issue is, how do you go about finding the right evidence to support that? So for example, you're not just going to go to like USA Today and get evidence from there. The idea that you're going to those credible websites and finding those sources that have that evidence. And then evidence-based decision-making is just a general overview about evidence-based decision-making that we put together, and you can certainly share that with your partners or colleagues, but that is just kind of an overall tool to help kind of build capacity and inform partners around evidence-based decision-making. So those are exciting for us, brand new launch with that, and the webpage will continue to evolve. There'll also be trainings on there, so you can always access trainings from things that we're doing through an evidence-based work group around a learning collaborative. So there are some things on there as well. So, so that's exciting to have that new resource. And with that, I think I'm on time here. I'm going to just thank you all for your time. There's my contact information, and invite you to take yourself off mute, ask any questions, or share any examples in our time left, and just appreciate the opportunity to learn and listen from all of you as well. Thank you, everyone.
Perfect. Thanks, Sandy. So yes, we have some time left today. If anybody has any questions, feel free to unmute yourself or go ahead and put them in the chat box. I see so far we have some just lots and lots of thank yous actually for today's webinar.
And I would invite you, we didn't go through all the websites I showed you, but if you're not familiar with those, I invite you to take some time and explore those. There's a lot of great resources out there if you're not sure where to find the evidence. And that new web page that I just talked about is a really good resource for that as well. So.
And as a reminder, all of the resources are in today's calendar hold as well as the slides, so you should have access to all of the links that were shared today.
Let's see, and Kelly, you have a question in the chat. Do you advise communities what they should be implementing, or is it more advising what data is showing? I think it's really a both. The idea is that you're doing it with communities. So if they're not, you can show them the data, and they may need to understand what types of strategies could be implemented based on the data. So you might actually have to do both and kind of do that guidance. But more importantly, having them part of that decision-making process once they have that data to inform their knowledge. And once you can kind of say, like, you know, for example, if I said that earlier, if your data shows you need a multi-unit housing policy, here's what the data shows. So, you know, I think you're going to have to do a little bit of both, but keeping them part of that process throughout as well. So hopefully that answers your question a little bit. You can always reach out to me afterwards too, Kelly. So happy to visit with you more about it. Any other questions or comments? Happy to visit with you. Or again, as I mentioned, you can certainly reach out to me afterwards today. So it's a heavy topic, I get it. So lot to process.
We'll do final call here. Any additional questions? I see another thank you came in the chat. All right, I don't see any questions coming in. I have a couple of just closing housekeeping items. So if anything comes to mind while I'm going through that, please feel free to put it in the chat box. But just want to say thank you again, Sandy, for your wonderful presentation today. I can see it was really appreciated from all the thanks in the chat box. But a couple of quick announcements before we close out today. First, we're really excited to announce that the Spring Institute will be taking place March 22nd and March 23rd, and it will be virtual again this year. So you'll all receive an official save the date over email, but we wanted to share this with you first today so you can go ahead and put it on your calendars. Also wanted to do a quick plug. If you're planning on attending the December 15th webinar, please be sure to register in advance. This is going to be a really fun interactive webinar with breakout rooms and a hands-on activity and lots of time for discussion with each other. So by registering in advance, we can make sure that we have an accurate head count for those activities. So Alexis is going to put that registration link in the chat box. She already did that, so feel free to go ahead and register now. I know it's really easy to forget to register, but appreciate you doing that in advance. So with that, I haven't seen any more questions come in the chat box, so we'll go ahead and wrap up here. Thank you again, Sandy, for presenting today. This was a really awesome webinar. And as always, we ask that you please fill out the survey in the chat box so we can continue to improve the webinar series. So thanks again, everybody, for joining us, and hope you have a great rest of your day.